Good afternoon, and thank you for being here. Today I'm joined by Dr. Joseph Canner. He's got some updates he's going to share with you all from the Department of Health. He'll be up in just a few minutes. Did want to start by talking about a trip I made to Lake Charles this morning to meet with Calcasieu Parish officials as well as officials from Lake Charles and Sulphur. And we talked about the efforts related to Hurricane Laura, interrupted by and exacerbated by Hurricane Delta, as you all know. And obviously we're doing all of this in a COVID environment. And I reaffirmed the state's commitment to continue working with them as well as with our federal partners. And I was pleased to be joined by Tony Robinson, who is the FEMA Region 6 Administrator there in Lake Charles today. Earlier this week, I also met with FEMA Administrator Peter Gaynor. We discussed the need to address the complications and financial challenges associated with two storms striking the same area so close together. You know, it was, I think, 5 or 6 weeks apart, Laura and Delta, but only 12 or 13 miles from where they actually made impact. And that poses lots of challenges when it comes to conforming to the rules that FEMA prescribes with respect to documentation for reimbursement and that sort of thing. And those were the major concerns, by the way, that were expressed to us this morning in Lake Charles. I did request a major disaster declaration yesterday related to Hurricane Delta. This included a request for FEMA individual assistance for the 5 most impacted parishes, those being Acadia, Calcasieu, Cameron, Jefferson Davis, and Vermilion. And then after further assessments are completed, I fully expect that additional parishes will be requested as well. This is similar to how we always operate in these matters. The National Guard today has more than 2,875 guardsmen activated in support of emergency operations. Today they're running 16 points of distribution in 5 parishes, those being Allen, Calcasieu, Cameron, Jefferson Davis, and Vermilion. There are still 81 weather-related road closures that are being worked on. Most of this has to do with floodwaters in various areas coming out of Rapides and into Evangeline Parish, for example, and over in Allen Parish on the Calcasieu River. So we ask everyone to continue to check 511la.org for real-time information on road conditions and closures. You can also go to 511la.org to monitor the schedule for debris pickup and see when that's going to happen in your area. Some good news related to our recovery from Hurricane Delta. As of today, 96% of the Delta outages have been restored in terms of electricity. And typically, for any Category 2 storm, the Public Service Commission and the energy companies will tell you that it takes 10 days to get 90% restored. We're 96% restored in less than a week, in 6 days. So that reflects several things, one of which is a tremendous effort by literally thousands of crewmen who were out there. But it also reflects the fact that there was less infrastructure damage, especially to transmission lines related to Delta, as compared to Hurricane Laura. As of this morning, we continue to have about 8,000 Louisianans in shelters. Of these, only 231 were Hurricane Delta evacuees. Most of those remain at the mega shelter in Alexandria. 7,697 were Hurricane Laura evacuees, and they are being sheltered at 12 different hotels, 10 in New Orleans, 1 in Baton Rouge, and 1 in Lafayette. Those are non-congregant shelters, obviously. And then there are still a little more than 1,500 Laura evacuees in non-congregant shelters in Texas, hotels. I do want to make sure everyone knows we're working with the Red Cross, with the state of Texas as well, and with folks in Southwest Louisiana, because it all has to be coordinated to bring these individuals from Texas back to Louisiana in the coming few days. Those with major damage are going to their homes, and so they're unable to return home, they're going to receive new hotel assignments here in Louisiana. And if they have the ability to drive and they have their own cars with them in Texas, we're going to ask them to transport themselves. Those who can't do that, we're going to be providing transportation to them. Those with minor damage from Laura, they may be able to return home depending on the damage they received from Delta. So we're working with the Fire Marshal's office and local officials to go take a look at those homes and make sure individuals know whether they can go home or not. And damage assessments are in progress to help identify evacuees who are going to need continued sheltering. And teams at the shelter are working with those who can't return home so that we can get them help with the housing options that are available to them. And anyone out there who may need continued sheltering and you don't have it yet, please contact your Office of Emergency Preparedness. And you can get a phone number to your Office of Emergency Preparedness by going to getagameplan.org. Or you can text LA Shelter to 898-211. Or you can simply call 211 with your question. We know that recovering from these storms, and especially doing so in a pandemic, is not just a physical challenge. It can be a mental challenge as well, and an emotional challenge. And we know that the residents of Southwest Louisiana have now suffered 2 devastating back-to-back storms in the middle of a public health emergency. Quite frankly, it's more than anybody should have to bear. So we're making requests to the federal government for more mental health resources. And in fact, on the White House Coronavirus Task Force call this past Tuesday, I was able to speak to Health and Human Services Secretary Azar about the need for a social services block grant that we are going to be requesting for additional resources in this regard. And we also have additional resources that are available to us. And now I'm going to ask Dr. Cantor to come up and speak about those resources, and he also has an update on COVID numbers for K through 12 schools. And then when he's finished, I'll come back up and finish up and then take your questions. Dr. Cantor?
Afternoon. Thank you, Governor. Thank you for leadership, and thank you for mentioning mental health in this. It's important to recognize the number of stressors that I think we're all facing right now, and to be honest with ourselves about that. COVID, we're now in our eighth month of the outbreak in Louisiana, and that's challenging. It's challenging with the stress, and certainly knowing people who have gotten sick or have dealt with it, or healthcare workers who have very challenging jobs. We've had more hurricanes this season than we had names for in the alphabet this year. And there's other stressors as well. There's an election coming up. There's legislative session. There's economic issues. A lot of things to be stressed about. And I think it's firstly important to take a second and acknowledge that. And after that, I think that people need to know that it's okay to feel stressed and under the gun. Not only is it okay, it's entirely natural and expected. And in fact, if you didn't feel any of that right now, that would be probably abnormal. I certainly feel that way on a number of days. I can tell you without a doubt, all of my colleagues that I know feel that way as well, and I would venture to guess that is the same for everyone out there. It's okay to feel that way. These are unprecedented times. And Louisiana, as the governor said, has had more than our fair share of hardship this year. It's not fair, but that's what it is. And it's okay to feel that way. We all do. That isn't to say that it's not a good idea to get some help if you think you need it, and to know what the resources are. And there are good resources out there. So I wanted to share two of them now in hopes that people know about them, and maybe if it's not something that you need right now, maybe your family member does, or maybe a friend does, and it might help to pass on information. First is a 24-hour 1-800 call line called the Keep Calm Hotline. This is operated by the health department. It's 100% free, 100% anonymous, 100% confidential. It allows you to speak with a counselor, to talk through anything that you want to without any charge, or any concern that your name might get out somewhere. It's a really good resource, and again, it's 24 hours a day. And the phone number for that is 1-800-310-7977. I'll say it one more time, 800-310-7977. Again, totally free, 24 hours a day, and easy to use, no judgment at all. And the other resource is a nice text line if you prefer to text, chat with someone. And to reach that, you just text reach out, all one word, REACHOUT, to 741-741. And that's reach out, one word, to 741-741. Again, 24 hours a day, free and confidential. And it's okay to use these resources. I've used them before in my life. Most of people that I know have used some type of mental health resource before. I'll tell you, it's probably abnormal if you don't feel that way right now. It's expected, it's normal, and people should know that there's good help available, either for you or for a friend or loved one. The other thing I wanted to talk briefly about is COVID in our K through 12 schools. And I'll share some data that was updated on the COVID dashboard yesterday, like it is every Wednesday. And also, I'll say, in general, the numbers that we're seeing are fairly encouraging. And that fits in with what we're seeing in other states as well. There's been a decent amount talked about how across the country, thankfully, we are not seeing large centers of transmission in the K through 12 environment that some people feared. And that's, number one, very thankful. And number two, particularly in Louisiana, goes to the credit of educators, teachers, principals, administrators who have worked really hard over the past 4 or 5 months to make for a safe educational environment. They're doing a really good job, and they should get a lot of recognition and credit for that. It's not been an easy job. So as of yesterday, I'll let you know that there's been a total of 495 cases of COVID in K through 12 students and 1,063 cases in faculty and staff in schools. Again, those are not numbers to ignore, but they've not been indicative to us of massive spread that I think some people feared, and we're very thankful for that. I'll also say that the early warning system that the Department of Health is implemented in conjunction with the Louisiana Department of Education is going very well. We have over 2/3 of schools across the state enrolled in this right now. That's really encouraging. We expect to have more enrolled in the next week or so. And what this system does is allow a school to have visibility on any outbreaks that might be brewing within their 4 walls. Because sometimes schools don't get all the information. Sometimes an individual might be in the hospital. Sometimes a family might not communicate immediately with the school. Sometimes the family doesn't know exactly what to communicate, what type of lab or test a person had, when exactly it was, and what it really means. And the early warning system allows the Department of Health to partner with schools to identify any potential outbreaks and mitigate them before they get larger. It's part of why we think schools have been as safe as they were. So we're really encouraged by that, and we look forward to more schools joining that. I will say, when we do see some cases, more often than not, it's been tied to some extracurricular activities, after-school activities or sports and so forth. So I want to let folks know and remind folks that the precautions that teachers and students are taking during the period, during classroom hours, they really do need to take those precautions as well after hours. It's just as important, and I think it'll cut down our cases even more so. But the system's really important, and it's been a good success so far. Governor?
Do y'all have questions for Dr. Cannon while he's up there?
Yes, sir.
Yeah, if you can speak more about mental health, because we've been through this for months, and the pandemic isn't going anywhere anytime soon. And it's a lot of COVID overload for people. In addition to the hotline that you mentioned, any advice for people who may feel overwhelmed, maybe something they can do close to what is normal to maybe feel like, okay, I'm back to pre-COVID, but still being safe and doing all the guidelines that we should do in order to make sure that we don't contract the virus?
That's such a great point, and I'm glad you mentioned that. we're obviously not close to the end of this. We're in the middle of it. And I think we should be honest with ourselves about that, because it helps let people prepare for it and get mentally strong. I think now that the weather is nice, this is an advantage that we have over a lot of other states in a number of ways. First, it's safer from a COVID transmission standpoint. Safer, much safer to be outdoors. And we can be outdoors now. In fact, it's beautiful today, and it will continue to be so. A lot of states right now up north, this is when you're going indoors. So we got to capitalize on that. The more time that we spend outdoors, there's going to be less transmission. That's a benefit that we have in Louisiana this time of year. But also, it's just good for you. It's healthy and makes you feel good to spend time outdoors. So I would really encourage people, number one, to spend as much time outdoors. Whatever activity you're doing, think about if there's a way to do it outdoors. It's going to be safer, and you're going to enjoy it more. The second thing I'll encourage people to do is to find connections with other individuals, and that could be family members or a clinician. I know a lot of people still don't have a primary care physician or a nurse practitioner. There's never a wrong time to go seek that out. And because of Medicaid expansion, we have a lot more access to care like that. So just because someone never took the time to get their own doctor before doesn't mean you can't or shouldn't do it now. In fact, having another person to talk to through any issue like that is helpful.
Thank you, Dr. Kanner. And with respect to COVID, today we are reporting 823 new cases. We are also, very sadly, reporting 12 new deaths. The death total is now 5,507. The 823 new cases we're reporting today were on 26,284 tests. I can tell you that we also are reporting 566 COVID inpatients across the state. And with respect to cases, positivity, inpatients, we basically over the last couple of weeks have plateaued. We're not in a great place. The good news is we're not getting worse. We're not in a surge right now, as we're seeing in many states across the country, especially those a little further north. But at the same time, our numbers haven't been depressed down to where we hoped they would be at this time. Obviously, the lower the numbers get, the easier it is to absorb a surge, and the more time you have to take corrective action in order to flatten the curve again before you lose the capacity to deliver health care. But having said that, I am very thankful that we've gone through Labor Day, that we've had K through 12 schools start up, higher ed start up, and 2 hurricanes with all the attendant preparations, immediate response, and recovery operations, and thus far haven't had a third surge in Louisiana. There's a lot of expectation in the scientific community around the country and around the world and in the medical community that this winter is going to be very, very challenging all over the country and including here in Louisiana. Obviously, the key there, and the reason why I believe we're not reporting a surge at the moment, is because of the mitigation measures and restrictions that are in place. And, a lot of times, and it'll happen in the school context, you just talked about it, but it happens in just about every context. As we go through time and we do better, a lot of people say, well, now that we're doing better, why don't we shuck those restrictions and get rid of these mitigation measures? Well, because those are the reasons why we're doing better. And without them in place, we're going to do much worse. And that is especially true if COVID is on the upswing around the world and around the country as it presently is. So wearing your mask, incredibly important when you're around people who are not part of your immediate household. Keeping physical distance of at least 6 feet from those same individuals, incredibly important. Washing your hands frequently with soap and water. Staying home when you are sick. And certainly being very mindful that there are those out there who are more vulnerable to this disease than others, and trying to protect them as much as possible. And then speaking directly to those individuals, whether you're 65 and older, whether you have a comorbid underlying health condition like hypertension, heart disease, kidney disease, and so forth, really make sure that you understand that there really isn't a safe crowd for you. and you need to be very, very careful. And one of the things that's being reported, and this was discussed by Dr. Birx on Tuesday with the White House Coronavirus Task Force call, many more cases than previously thought are arising from relatively small informal gatherings, typically at someone's house or in someone's backyard, or you have a party with a birthday party, a baby shower or a barbecue for somebody or whatever, because you typically invite small numbers of people. You know those people really well. They're probably neighbors or close family members or very close friends. And there's just this irrational assumption that if I know someone well, they can't have COVID. Well, that's obviously not true. And there's a outsized degree of transmission coming from those settings. And so we've been asked to remind people of that. And any time you're around someone who is not part of your immediate household, even if that person is your mother or your father, your grandparents, whoever, please make sure that you are wearing a mask and that you are physically distancing. Obviously, COVID remains active, and we're entering flu season as well. You all know that earlier this week, I and a couple of my cabinet members went to Our Lady of the Lake in North Baton Rouge and got our flu shot. It is extremely important, especially this year, even for people who typically don't get the flu shot, or maybe they've never gotten the flu shot, to do it. It is safe, it is convenient, it is either free or low cost, and so we're encouraging people to do it, and in fact, it is safe for people 6 months of age or older. And obviously, we don't want to have a significant flu season while we're dealing with COVID-19, because they put demands on the same portion of our healthcare delivery system. And it just would not be a good thing to have our hospitals dealing with high numbers of flu cases and high numbers of COVID cases, many of which in the early days could be confused, by the way, and so forth. So we're asking people to make sure that you get your flu shot this year. And, you know, there are a number of myths around the flu shot. You're not going to get the flu from taking the flu shot. You're not going to get COVID from taking the flu shot. Getting the flu shot isn't going to prevent you from getting COVID either. But you know, it is safe, it is effective, it's the best way to protect you and your family against strains that are predicted to be the most common for the year. And the last thing I'll say about the flu are those mitigation measures that I mentioned just a while ago for trying to control and minimize the transmission of COVID also help and work tremendously well with respect to the flu, because the flu is transmitted in much the same way. And so we encourage people to do that, and if they will, we will see the lowest number of COVID cases, but also the lowest number of flu cases, especially if the mitigation measures are accompanied by the vaccine. And we can all look forward to the day when the COVID vaccine is available, or I should say vaccines are going to be available for us. You can get your flu shot at your local pharmacy or your doctor's office. Starting today, the Office of Public Health is holding its annual flu vaccination clinics across the state. These will be no cost. You can find out more at ldh.la.gov/fighttheflu. Today is the last day to respond to the census. That caught some people by surprise because of some action taken by the Supreme Court earlier this week. There was a thought we were going to have till the end of October. I can tell you Louisiana continues to lag slightly behind most other states in our response rate, but we do have a few hours left, and so I encourage people to visit my2020census.gov today. And if you are going to respond by mail, the postmark has to be today on your mail. With that, I will take your questions. Yes, sir.
Governor, week right before Hurricane Delta hit, you said you didn't expect that people being sheltered in the mega shelter would be there for more than 24 hours. It's now been almost a week. Why aren't those 231 people in hotels right now?
Well, they have been putting into, first of all, not all of those people have been there the whole time. Every day we get some more people. And so I can't tell you how many have been there for X number of days or whatever. But we have been putting people in hotels, and we've been bringing people back to Lake Charles as well. But one of the good things is the capacity there is 588 during COVID, meaning that we're spacing folks out on the floor in a way that is as safe as possible, and we've never even approached the 588. But we haven't had all of those individuals there every day. That's the current number. I don't know the answer to that question. And as I mentioned, I'll try to get that to you. I know that we are in the process of returning evacuees, whether they're Delta evacuees or Laura evacuees, back home if their homes don't have damage or if they're only slightly damaged, so that those homes are safe, habitable, and secure. And then that takes work to go and actually look at the home in question, do an inspection, and then communicate that back to the individuals. All of that's going on, and I can get the information to you about, at least I think I can, from the Department of Children and Family Services about the number of people who are in hotels today who are evacuees because of Delta. Yes, ma'am.
What was discussed, and if you saw the body cam video that the family was allowed to see as part of that discussion?
No and yes. I'm not going to tell you what was discussed. It was a meeting between me and the family, and the mother and sister of Mr. Green were accompanied by some of their lawyers, and the video and other evidence in the case was made available to them. And I have watched the video. I did not watch the video during that meeting when it was presented or made available to them, but I have watched it previously.
And what are your thoughts?
Well, like every video of that type, disturbing for lots of different reasons, but I'm not going to go through everything on the video here. I will tell you that I appreciate the fact that the district attorney who is handling this matter, but also the U.S. Attorney's Office who's looking into this matter, both believe that it was appropriate to allow the family to watch the video and have access to some more information as well. But they both also believe it's not appropriate, and in fact would be detrimental for that video to be made public while it is in fact evidence that they are considering. And so because it's evidence that they're considering and they don't want it made public, I'm also not going to sit here and characterize it.
But when you say it's disturbing, was that something you think would be in that video, and what you know the state police response has been so far? Do you think the state police has responded appropriately and fast enough based on what you now see?
Well, first of all, I think you may be reading things into my saying that it was disturbing. It's disturbing for a number of reasons. Anytime you see a video that you know captures the events around someone's death, it's disturbing. But I'm simply not going to sit here and characterize the video for you or characterize my feelings about the video for you. Yes, sir.
Status of negotiations. Have you been meeting with lawmakers on the emergency powers issue? How is that going? Do you feel good about reaching something you'd be willing to sign?
Well, I always look forward to getting bills as they arrive at my desk so I can actually read the language as opposed to ideas that aren't yet incorporated into them or even discussing bills that ultimately aren't going to pass and be put on my desk. Quite frankly, you know, when I look back at this public health emergency and the decisions that we've made, I will tell you that I know that we have made the best decisions possible, given the information that we had at our disposal and the recommendations that we've been receiving from the scientific community, from the medical community, and from the White House Coronavirus Task Force and so forth. So I never thought that this particular session, as it relates to those bills, was warranted. And so, you know, I'm not sure that there's anything, I'm not going to say nothing, because I think we should always hold out that there's room for agreement on something. But the vast majority of the instruments that I have seen and heard debated and so forth aren't things that I would ever acquiesce to. And we're going to continue to responsibly manage this public health emergency with all the tools at our disposal that we can muster. And I'm not going to surrender any of those tools when we still have a very real public health emergency. And when you look at the arguments being made, the simple fact is there are folks in the legislature who don't want any restrictions or any mitigation measures, and that's grossly irresponsible. And they will never tell you that the decisions that I have made have been those that have been recommended by the White House. But that, in fact, is the case. And so it's kind of sad that we're here. It's sad that things are as partisan as they are. I can tell you I have made a conscious effort and a good faith effort to be as bipartisan or nonpartisan as I can be when it comes to this public health emergency, because I believe that's the best way to manage it. That's the best way to maintain credibility in the decisions that you make. And so you haven't seen me out there criticizing individual legislators or the president or the White House task force or anything like that. It's just unhelpful. But it's also unhelpful to be here under these circumstances as well. I thought that might generate something. Yes?
In terms of the supplemental budget bill that's obviously still being debated, last night there was a discussion on the House floor about the $20 million in legislative earmarks that were added. Are you okay with them taking money and putting it to specific local projects, or is that something that you don't approve of?
Well, look, I will look at the supplemental appropriations bill if and when it comes to my desk, as it is at that time. As we came into the room, it was not clear to me whether they were going to make another attempt today to pass the same conference committee report, or whether there was going to be a different conference committee report that may or may not have those projects or may not have them all. And so I just don't feel like it's a fruitful exercise for me to comment on an instrument that is likely not the one that I'm going to receive if I receive one. And I always reserve the right to read a bill as it is when it comes to my desk and make a decision then about whether to sign it or not. And because this is an appropriations bill, a line item veto is an option too. And I'm not saying that to predict that I'm going to exercise the authority that I have with respect to a line item veto, but it is something that I can do if I believe that it's warranted. Yeah. You know, if we, first of all, I would hope that they make sure that we do things to shore up the solvency of the Unemployment Insurance Trust Fund. I know that there's some of that in the bill. If we can move more money to the local efforts with respect to the CARES Act, I think that would be a good thing. There are some other things that we know to be really important and to be a priority for the state. And so if those things are in the bill, then it's certainly a whole lot easier to accept some of the other things that might be in the bill. And that's why it's the total mix. It's the balance that you see and so forth. And I'm here commenting on something that is at this point hypothetical. I don't know what we're going to get.
Last question?
Yes, sir.
Of course, we mentioned this before we talked about mental health earlier. All of us are dealing with a lot.
Yeah.
Especially you as the governor. And I think a lot of times people forget you're a person. My question to you is, how are you?
Thank you for the question. I am doing very well, and it has been a challenging year, and for me too. But the fact of the matter is, it has been much more challenging for those ICU docs and those nurses and those respiratory therapists and those EMTs. It's a much more challenging year for those teachers and those principals and school administrators, and it's a much more challenging year for sure for those who've contracted the disease, who spent time in the hospital, those whose loved ones have gone through that, and most challenging of all for those people who've had close friends and family members die of COVID-19. In Louisiana, as you saw, it's 5,507 as of today. So I appreciate the question, but I am doing well, and my family is doing well. And you know, I would ask that we continue to focus on being good neighbors to one another and doing what we can to make sure that we're doing our part to prevent the spread of this illness. And I do hope that individuals out there will not be tempted to cope with this and to ease whatever anxiety they have or emotional distress they have by minimizing the threat posed by COVID-19, or certainly not by denying COVID-19 altogether. We know that happens with respect to some people, but it is not a reasonable thing to do in light of the overwhelming evidence about how contagious this disease is and how deadly it is and the impacts that it's having across the state and across the country. And so I know that is a coping mechanism, but that's one that's not beneficial to us, because then we end up with behaviors that actually result in more spread, not less. And we all need to do our part, and we need to make sure that we're embracing these mitigation measures, that we're being good neighbors, and that we work our way through this. And I am very much looking forward to the day when I don't have to have a press conference and talk about COVID-19 and tell you how many people we've had die in the previous 24 hours. I've been doing that for 8 months, and I've never come out and given a zero. So we still have a lot of work to do here, around the country, and around the world. And we just need to be realistic about that. And we need to understand we can have the most normalcy possible if we will engage in the mitigation measures. The most absurd thing is to have people who say, well, we want everything open, but we don't want to have to do any of the mitigation measures. You know, that means you just don't care. And that's not representative of a majority of people in Louisiana. In fact, I will tell you it's a distinct minority, but they're loud. You know, and we just need to be good neighbors. We need to be good Louisianans, and we're going to get through this. And we need to continue to lift one another up in prayer. Thank y'all so much. Christina, we'll see you when?
Next Thursday.
All right, we're going to try to get back on a weekly schedule, so we hope to see you next Thursday. If something happens and we need to address you before then, we'll let you know. Thank y'all.